For many years, there have been scares that using a cell phone will increase your risk for developing cancer. And there's a lot of ongoing research to evaluate whether or not this is true. Early studies did not show any genetic mutations induced in human cells, but it's still a fear that people have. Now, there was an earlier study that did show the development of brain tumors while using a cell phone. But when they tried to look at that again, especially in people who have occupational exposures of radiation, they did not find an increased risk in those particular individuals with cell phone radiation to develop brain and head cancers. Now, statistics show that a total of 8.6 billion phone subscriptions exist in the year 2022. Hi, I'm Dr. Naznin Jamal. I'm a board-certified internal medicine physician, and my goal is to empower you and your loved ones on basic understanding of medical diseases and concepts. So let's begin. Researchers in Australia set out to determine whether or not there was a link between cell phone or phone use and the development of head and neck cancer. They looked at 63 studies from 22 countries from the years 1994 to 2022. And they looked at three types of exposure: near, far, and in between. They looked at phone use, cordless phone use, radio transmitter base stations from televisions, and other types of transmitters. In particular, they looked for specific types of tumors. They looked at brain tumors such as glioma and meningioma. They looked at acoustic neuromas, which usually happen in the space from your inner ear to the brain. They looked at pituitary tumors. The pituitary gland is located deep within the brain and is responsible for secreting hormones to your glands. And then finally, they looked at salivary gland tumors, which are in the mouth. And they found that there was no increased risk for developing these tumors. Whole body exposure from television sets also did not increase the risk of leukemias or childhood tumors as well. Now, there were problems in this study. First off is that they involved a huge amount of recall bias. What is recall bias? Well, any study in which the participants are asked to recall a particular issue, such as in this case, the amount of time that they spent on the cell phone and where the phone or the transmitter was, is compromised. It is very difficult to ensure accuracy of the information that's given to you. Second, there weren't enough studies involving children in this analysis. There also weren't enough studies involving occupational exposures and their risk of developing cancer. Also, there was a lack of follow-through. What do I mean when I say that? Well, when a study is concluded, usually that's the information that you have and present to the world. But what happens to the participants after the publication of the study is also relevant, and we don't have that information. We don't truly know if those patients, those people that did not develop cancer, did end up developing cancer later on. And then finally, these analyses that were reviewed actually looked at older cell phone networks, 1994, 2022. We now have the 5G mobile network. We don't really have enough information to know if there's an increased risk of cancer with this new network. So, in short, the data shows that there hasn't been an increased risk of cancer from using your cell phone, but with changing technology, that can also change. And once I have more updates, I'll post another video to give you all more information. Until next time.